Hi friends, today I'm going to start my lecture video with few case scenarios. Okay, so let us see one by one. The first one, 15-day-old child was admitted with the complaints of fever, irritability, poor cry and poor intake of feeds. On examination of the child, it was febrile and lethargic. Okay, so try to make a guess. Okay, next, in the second scenario, listen carefully. 15-year-old girl was admitted with a fever and intense headache. On examination, signs of meningism was present. Her vaccination status was not known. Okay. So in the third scenario, 32-year-old male patient was admitted with a similar complaints. History of recent swimming in the pond water while visiting his friend's village. Okay. So coming to the fourth scenario, 55-year-old farmer was admitted with a similar complaints, which means fever, intense headache and neck rigidity. Okay, his wife gave the history of recent heavy rainfall in the residing area. So obviously it would have been a flooded street. Okay, then he developed fever with the jaundice 10 days back, for which treatment was not taken. In the last scenario, 44-year-old male patient, he was a bird fancier, presented with a similar complaints. On examination, Kernick sign was positive and his CD4 count was low. Okay, now try to make a guess. So the diagnosis is meningitis. Okay, meningitis is the diagnosis for all the above mentioned cases. But you have to understand one thing, the cause and source are different. Okay, so today's topic is on meningitis. We are going to learn what are the causative agents and what are the sources. Is there any vaccines or not? Okay, so meningitis means inflammation of the meninges, that includes brain and spinal cord. Okay, so how meningitis is broadly categorized, how it can be categorized? It can be categorized into two types. One is called pyogenic, the other one is aseptic. Pyogenic meningitis, aseptic meningitis. As the name indicates, pyogenic means pus cells. There will be plenty of pus cells, which means neutrophils. Whereas in case of aseptic, actually the term asepsis means absence of sepsis. Okay, it's actually a misnomer which implies a lack of inflammation, but there is inflammation. So here it will be plenty of lymphocytes. Okay, so this is the first differentiating point between pyogenic meningitis and aseptic meningitis. So obviously if there are plenty of neutrophils, so the condition must be acute. Okay, here next thing is causes. So causative agents. So mostly bacteria are responsible for acute pyogenic meningitis. Here the causes are few bacteria, few exceptional bacteria are there. Next, viruses, parasites, fungus. Okay. Now, coming to the bacterial causes, there are a group of bacteria which can cause meningitis, but again it has to be subcategorized into three groups. Okay, based on the age group, the bacteria may vary. Okay, for example, neonates or 0 to 3 months. Okay, up to 3 months of age group, the organisms will be different. Next, adolescent, adult group or elderly age group, the organism would be different. It is varying. Okay, so up to 3 months, what are the organisms? The mnemonic is leg. Okay, Listeria, Enterobacteriaceae, especially E. coli and Klebsiella. G for GBS, group B streptococci. Okay, group B streptococci is nothing but strep A galacti. Okay, so these are the common organisms which could be the agents of meningitis, especially in this age group. Okay, coming to the adolescent, adult and elderly age group. Again, elderly age group, Listeria would be the predominant organism. Okay, coming to the adolescent and adult age group, the organisms, three organisms are the pneumonic shint, okay, streptococci pneumoniae, Haemophilus influenzae, especially type B. Okay, the capsular type, serotype B is the most invasive form. Next, N for Neisseria meningitis. So the next point is source. Okay, how neonates get the infection, that is meningitis, how the other age group are infected with this organism, that is called source. Okay, so source is from via the infected birth canal of pregnant mother. So these organisms are responsible for colonization, okay, especially the genital region. So from that the neonate obtains the infections. So what could be the source in the other age group, rest of the age group? Okay, here, so in the community, okay, it's a community strain. So obviously in the closed environment. So the route is respiratory route, especially droplet. These organism colonizes the nasopharynx. Okay, so asymptomatic colonization is possible by these organisms. Okay, so in the question, if it is mentioned the neonate presents with meningitis, means you can choose any organism among this. Okay, in the question, if it is mentioned like 15 or 20-year-old, so adolescent means almost 15 to 15 years, so it's 20 to 60, this is more elder. Okay, so if it is mentioned, age group is mentioned, means you can choose. Okay, suppose if the age group is not mentioned, the question is like most common cause of bacterial meningitis, means the answer must be streptococcus pneumoniae. Okay, remember all are capsulated bacteria, especially streptococci, Hib and the Neisseria meningitis, all are capsulated. They all are vaccine preventable. Vaccines are prepared from the capsules of this particular organisms. Okay, so they all are vaccine preventable. Meningococcal vaccine, pneumococcal vaccine, Hib vaccines are available. Okay, coming to the aseptic meningitis, here lymphocytes are the predominant cell, and causative, among the causative agents, I said few bacteria will cause aseptic meningitis. Okay, example Mycobacterium tuberculosis, so one of the extrapulmonary tuberculosis, and then that is called TB meningitis. Next, leptospira. The last is Treponema pallidum, which is neurosyphilis. Okay, tertiary stage. Coming to the viruses, the most common virus is enterovirus. Under the enterovirus, polio and Coxsackie virus. Next, myxovirus. Among the myxoviruses, paramyxo are more prone for meningitis than orthomyxo. So orthomyxo is very rare, that is influenza. Among the paramyxo, mumps. Okay, again that is also secondary. The next is fungus. Among the funguses, most common cause is Cryptococcus neoformans. Remember, it's only true yeast which is capsulated. It's only capsulated fungus. Okay. Then other causes, that is least common, is disseminated candidiasis, disseminated candida, and then disseminated aspergillosis and all. Okay. Coming to the parasites, free living amoeba. They are more prone for causing this infection, free living amoeba, so which means it lives in the environment, free living, especially in water. Okay, so infective form here is tropozoid. Okay, this is responsible for, this is the infective form and causing meningitis. So there should be a history of swimming. Okay, recent swimming. Organisms are Naegleria fowleri and Acanthamoeba. Okay, the other causative agent is toxoplasma, especially in immunocompromised patient, Toxoplasma gondii, especially in immunocompromised patients, HIV patients. Usually it causes TE, the condition called Toxoplasma encephalitis. Okay, so far we have learnt about the causative agent and source of infection, that is meningitis. Next, coming back to the cases, Now we'll evaluate one by one. Okay, in the first case, it is mentioned that 15-day-old child, which means it comes under newborn. So obviously the source is from the infected birth canal of a mother. Okay, so the organisms would be like Listeria, Enterobacteria, especially E. coli, Klebsiella, or GPS. So your option must be any one of them. In the next case, 15-year-old child, it comes under adolescent. So the source is from respiratory route of the other case, okay, or carrier. Girl child was admitted with a fever and intense headache. So here it is mentioned that vaccination status is not known. So vaccine preventable bacteria, that is SHIN, Shin. Okay, Streptococcus pneumoniae, Hib, and then Neisseria meningitis. So obviously the organism must be any one of this. In the third scenario, it is mentioned that recent similar complaints with a recent swimming in the pond water. Okay, so obviously the organism is parasitic cause, especially free living amoeba. So in the fourth scenario, it's clearly given that he is a farmer by occupation, and also there is a recent rainfall in their residing area, and clinical point is fever with jaundice. Okay, it is clearly mentioned that rainfall. So the three are rainfall, rice field, rodent. Okay, it's epidemiologically important in causing leptospira. Okay, they all are responsible for leptospirosis. So the case is clearly seen that leptospira, fever with jaundice. Obviously the next stage would be Weil's disease, that is hepatorenal pulmonary syndrome. Okay, the next is 44-year-old male. Again here is the clue is bird fancier. So his occupation is bird fancier. So the causative agent would be fungus. Okay, you can suspect he is immunocompromised patient. You can see his CD4 count is low. So in immunocompromised patient, especially in HIV, most common organism causing meningitis is Cryptococcus. Okay, yes, that's all about the meningitis. Hope this video is useful. Thank you.